In this module, we'll be reviewing forearm x-rays. This includes the AP and lateral views. For the AP forearm, you'll have the patient in a chair next to the examination table. You'll want to have them extend their arm out. You have a cassette on top of the table. We're doing this tabletop with no grid. The camera's 40 inches away. And you'll have the patient extend their arm out with their palm facing up. The reason you want them to extend out is so that you can get the elbow as flush as possible to the cassette, and you want to slightly hyperflex the hand so that outward so that you're getting a true AP. The arm is completely extended, the elbow is straight, and of course you're getting the joints above the elbow and below the wrist, so you're seeing the radius and ulna in their entirety. You also want to make sure you center your crosshairs to the mid shaft and you're marking your film appropriately, either right or left. A good baseline technique would be 2 mass at 58 kVp. Now, I've combined both images together, the AP with the lateral, to start off with, simply so that you'll understand they're very close to one another. If you're not used to looking at these x-rays, it can be confusing. So I just want to kind of identify highlight some of the differences so that you can readily look at a film and tell. First, with an AP wrist that's included slightly here, you can see some of the carpals up here, the bones that are kind of spread out, and you see the radius off to one side and the ulna off to the other, so you can see this is kind of a clear AP wrist. Now we can identify that at least this side of the image has been positioned appropriately. The elbow joint down here is slightly rotated. It's not as true AP as the wrist was, but you can see the olecranon of the tibia coming into the humerus, and you can see your funny bone and or the 2 condyles that are kind of off in profile. So this will help identify that you've got a good AP running here. Also, in the AP, you've got a good gap that separates the two of them between the joint spaces. So once it opens up in the middle, and it'll converge back to the 2 end pieces, that's not something that you see. So in contrast, as opposed to an AP wrist, we see a profile of a wrist, a lateral wrist right here, where you might see 1 or 2 of the carpals as opposed to what we're seeing up here. You also see an overlap of the radius and ulna in the distal area, as well as coming closer to the elbow. We only see a small opening in here. Now look at the lateral elbow here. You see how the condyles kind of overlap one another. They form a little circle. So now you know this is a lateral, and of course this is an AP. They look a lot alike, but when you break it down and review it, you can pretty much tell which one is which. See this here? We see the distal joint spaces. This identifies, at least on the AP, we can look at the joint spaces in AP position. Now for the lateral forearm, this can be a little tricky. You must shoot to get a true lateral, and the only way to do this is to get the patient, just like we did on the AP, to extend their arm out across the table to where their upper arm is almost flush against the table. So you really want to make them reach, if they're able to, so that you can get that elbow in a good lateral position. If you don't, then you're going to have a kind of a lesser elbow, a lateral elbow. Your whole lateral forearm is going to be compromised. You want the patient's hand in a karate chop, so to speak, so your thumb's on top and facing down, and you're going to center mid shaft and get a good lateral this way. Whoops, got another film in here. Okay. Moving forward, if you can't get a good lateral, a good forearm this way, remember, we got a lateral elbow using the patient making a muscle. If you walk them up to an upright bucky and you have them make a muscle, so to speak, you can get a lateral elbow, but you can also get a lateral forearm this way as well. So there are a number of ways you can get this film if you're having trouble. But again, make sure you remember to include the elbow joint and the wrist joint on this film. And again, once we see it here, you've got your elbow in profile and your wrist in profile. Good laterals for both. And so that you'll understand this, the AP was done with the palm facing up, and the lateral was done with a karate chop on the board, and this is the difference that it makes. So long as you have your hand in good position, you can get away with getting some pretty solid films, as long as you stay true to the positioning methods here. It's surprisingly easy to have to do one of these films over again, even if it's as little as not turning the hand the appropriate way. And that concludes our review of the forearm images.